we are going to learn psychiatry together. Are we ready for it? Okay. So how the class is structured will be based on the index only, and the entire workbook and the syllabus is framed based on our CBME curriculum, competency based medical education curriculum. So we are expecting that the NBE board, which is setting the exam for NEET-PG and the INI-CET, are basing their questions on this competency based curriculum. So CBME curriculum is the basis for it. So there are certain chapters which will look rudimentary or incomplete, basically because it is a touch and go, because there is an integration between various other chapters. So such chapters I'll try my best to just give you an overall idea and what are the questions that can be expected. So other than that, the chapters which require in detail explanation in order to understand will be taken in detail. And wherever you feel that I am fast or a particular topic is unclear, you can type it in the chat box and I will definitely repeat it. And at the end of each chapters, we will discuss certain questions based on the workbook also. And also there are certain chapters which was framed in the workbook in order to make the students write so that they will have a better retention. But during the live sessions, it was found that it became a little too tedious for the students to write. They struggled a little. So what I have done is, for such chapters or pages alone, I've written and created a separate PDF which I will share during your first break. You can have that, so you do not have to write it. You can just highlight it or just read through it and listen to that class, right? So that will be like 1 or 2 pages in the few chapters, and the entire chapter of psychosomatic disorders and therapeutics in psychiatry, right? Okay, so let's go into the topic. The workbook has a little theme based on the minions, basically to make psychiatry fun and learn together. So every time there is a fun element in understanding certain concepts, it is proven neuroscientifically that there is better retention. So if you remember in your anatomy dissection table, or in your physiology labs, or even in your clinical postings, whenever you were with your friends and were making fun, okay, what is this muscle, why is this doing this, or that kind of comments, that you will be remembering even till now, even after years of those anatomy or physiology classes. Whereas some things that you sat and tried to read it or mug it up will not be retaining in that same fashion. So we are trying to include a lot of examples and fun element so that we can make psychiatry interesting and better to remember. There are basically 5 to 7 questions that is asked in psychiatry both for NEET-PG and INI-CET, and out of these 5 to 7 questions, 40% to 60% of the questions are easy. So the point is, just by listening to the class and recalling all of this, you should be able to just go and answer. You need to spend another half day for psychiatry revision, and on the last day maybe half an hour or so for psychiatry, and that should be it for 5 to 7 questions. That is the entire point. But the problem is, in MBBS curriculum we hardly learn psychiatry, right? You might have like 2 weeks posting in your third year or your final year, which you generally go out for movies and do all of those fun stuff, right? Also, psychiatric questions are asked in MBBS medicine paper 2. I think one short note is alone asked, that we hardly write based on Davidson's that few pages of psychiatry. So the entire point is, understanding psychiatry requires a little more attention. Once you've understood it, all the questions asked from psychiatry will be mostly easy. That 1 or 2 difficult questions we can try to attempt it based on the concepts alone. Okay, right. So have you all seen these movies? Anybody can tell me what are the psychological underpinnings that is present in all of these movies? Anniyan, Alavandan, Atrangire, 3. Anybody? Just let's make it interactive so that I know you are not sleeping and I am aware that some people are listening. Okay, what is BPD? Multiple personality disorder. Yes. So in Anniyan they had discussed, yes, split personality, whatever. What about in Alavandan or Atrangire or 3? I think Pirai Sudan BPD are meaning as bipolar disorder. Okay. Okay. So in 3, they mentioned it as bipolar disorder, but there are lots of controversy. We do not know what the exact diagnosis is, but yes, thank you. So these movies have a little, psychological underpinning to it, right? And also, what about in Tare Zameen Par? Anybody? And Chandramukhi, Dear Zindagi, Irgapatru, dyslexia. Yes, thank you. Thank you, Preeta, Nandini, Rana, Bhavadarini. Yes. What about in Dear Zindagi? Anybody? So, in Irgapatru is basically the psychological couple counseling or the marital therapy. Dear Zindagi also has a therapy aspect to it, based on a personality disorder, and Chandramukhi also has a lot of split personality and stuff. Right. So psychiatry is everywhere, right? Just to make it in that fashion. Okay. So the first chapter, like I told, it is added for completion's sake. It is there in the CBME curriculum and hence it is written here. But out of this context of exam preparation or psychiatry per se, all of the skills written in this chapter is needed for you no matter what specialty you take, or even if you practice as a general practitioner or you go for super specialty, whatever, these skills are necessary for it. What are these skills? Doctor patient relationship. What is doctor patient relationship? It is the relationship between the doctor and patient, which is having a an interpersonal connection between the doctor and patient, right? It has a stage for interaction. We interact with the patient, patient interacts with us, and it also importantly comes with obligation, right? So we have a duty to the patient and the patient has a duty towards the doctor. And the most important point is it has some or the other therapeutic effect. So if you have a good doctor patient relationship, your treatment is going to work better. So whatever people in lay people call as kairasi or whatever, if we go to this doctor, we get cured of all illnesses. The doctor might be an ophthalmologist, but they go for a fever or they go for something else and they say that they are cured. That is because of this therapeutic effect of the doctor patient relationship, and it is one of the soft skills that is important for everybody in medicine. Okay. So in psychiatry, it is even more important because psychiatry, the entire process of evaluation, assessment, everything is based on this doctor patient relationship, and it is mostly interactive, right? You do not do a test. There is no test in psychiatry for diagnosis. You do not do any examination per se. Your entire psychiatric examination is also part of your interview, which we will see in the subsequent chapters. So that you need to introduce yourself, ask for the patient consent, ensure there is privacy and confidentiality, which is very, very important. A patient may come in and disclose a love affair or an extramarital affair, or even sometimes attend some unethical things that the patient is doing, but still we have to maintain that confidentiality. It's a very thin line, right? And empathy is one of the important skills that we might need to know. What is empathy? Empathy is different from sympathy, as you might know. So somebody meeting with an accident on the roadside and you look at them, oh my god, pavam, what is happening to them? That is sympathy, right? Okay, they are going through a hard time. That is sympathy. What is empathy? Empathy is an objective view. We need to have empathy more than sympathy, because sympathy cannot do anything. We need to be able to put ourselves in their shoes. Okay, what are they feeling? What are they going through? Okay, they are going through a divorce, or they are going through a grief, or they are going through a stress because of NEET-PG preparation. So what is the entire emotional status or the thinking pattern that they are going through? And then we will be able to address it better. So that is empathy, putting yourself in their shoes and understanding their emotions. And for that, you always need a rapport. So rapport is the is the binding relationship between the patient. So in the therapeutic relationship, what you build is a rapport. So you would have seen, it's like you would be trying to ask the patient family history or sexual history or whatnot, and they will not tell you. And once you bring the patient to your professor or to somebody senior to you, and they will be in minutes finding all of these important key historical points. Why? Because they have developed that skill of rapport building in minutes. That is very, very important. So only if you build that rapport, only if the patient trusts you, they will say all of the information, right? Safety and comfort, again, that is important. And in psychiatry specifically, we need to ask more open-ended questions. We should not ask, are you depressed, are you feeling sad for the past 2 weeks, because that is the criteria for depression. So you are asking, are you feeling depressed for the past 2 weeks, are you feeling anxious, are you having suicidal thoughts? No, we need to ask open-ended questions. And that is the same for all specialties also. What brings you here, right? Chief complaints, what brings you here, what are you going through, how can I help you, what are the problems that you're facing? So open-ended questions, so that the patient can open up about their problems. And once they are deviating, etc., and once they have told your story and you need certain clarity, then you can go for closed-ended questions in the later part. Okay, right. So this is the doctor-patient relationship and principles in psychiatric interview. Now, communication is again an important part, right? Communication is a psycho-behavioral phenomenon where there is verbal and non-verbal aspects of communication. You should be sitting in a posture, you should have a good eye contact, you should be having a the facial expressions and body language, that you are actually ready to listen to the patient. So if you are like checking your phone, looking through a reels, okay, yeah, fever for how many days, okay, fine, fever, okay, go. So that is not the communication, and communication is very, very important. Again, that skill is important for doctor patient relationship. Again, that is having a therapeutic effect. So who all do we communicate with? We obviously communicate with the patients, but we also communicate with the caregivers. We also communicate with the members of the medical team, like your colleague, your junior, your staff nurse, your OT technician. All of that we communicate. We also communicate with other third parties and public, like the insurance company, like Facebook and Instagram reels where we share content. So all of this is communication. So for the therapeutic relationship, we communicate with the patients for accurate history, right? And also the treatment options, pros and cons, side effects. So for an informed decision making, and also to make sure that the patient and the caregivers understand everything, so that there is no legal liability later. No, doctor, you did not tell about this, how can you not tell about this and do this procedure? So that kind of communication is very important. And with the members of the medical team, we not only just talk, right? Communication is also written. The case sheet where we write notes, to do CT brain, to do serum electrolytes, all of these are also communication to the staff of the medical team. So maintaining a good clinical record is also communication. And what I am doing to you, or what you do to the other people while you're teaching a case presenting, training and teaching also comes as a part of communication. And for the insurance companies and employees, obviously, right, we have to communicate properly. In all of these, we need to maintain our code of ethics, which all you would have learned in your forensic as well. Like I told, this is an integrative chapter. So what are the good components of a good communication? Like I told you, there is verbal, the language, right? So when you get a PG seat in, let's say, Delhi, you need to learn Hindi or whatever is the local dialect there, and only then we can be better communicators there, right? So language, the terms that we use, even in Tamil Nadu, the terms that we use in Chennai is different from what they use in Madurai or Tirunelveli. There are local variations. Even for when I was doing my PG, they used to call cough as thorathal, right? So all of this will be very new, but this needs to be learned, right? Non-verbal communication, like I already told you, the eye contact, the facial expression, the body language. Paraverbal is a tone of voice. Like if you're having a very blunt voice or a very high voice also, the patient will not be able to get that therapeutic relationship. And the environment of the consultation room layout, it should be in a very proper way. The patient is able to sit comfortably and talk to you, and all of that. Visual communication, visual elements you can use for certain sensitive topics or topics which require excessive explanation, right? For example, sexual history or sexual dysfunction history, or to explain the patient that you have a renal calculi in this area. So if you do draw it or use a PowerPoint presentation, that will be ensure better communication, right? Now, this is the most important topic of this chapter, which is again part of a doctor patient relationship, communication, that is breaking bad news. So, whenever there is a bad news, right, let's say cancer, or let's say a patient is, dead, right? Or recent days we had patient had COVID. So, all of these are bad news to the patient, but we will think that certain things are very easy to digest, but actually even a diagnosis of type 2 DM is also a bad news to the patient, because the patient is like, okay, yo, should I take the medicines for lifelong? What will happen? Will I lose my toe? Will I lose my feet? All of these will be the concern. So everything we should look in a patient's perspective. So for the spikes protocol, you can just write it, it is there in the explanation also. The setting should be appropriate, right? So when there is a lot of violence against doctors, a lot of times we feel that the inappropriate setting and the inappropriate protocol to break bad news is the problem, and that is because of a lot of logistical concerns, right? When the casualty is so crowded and you go out and say the patient is dead, that is not an appropriate way to say, but still we are doing it because of the logistical issues. The setting should be appropriate. You should take the attender or the patient separately, make them sit comfortably, and then look at their perception. What are they expecting out of you? Like, they would have come for, let's say, a small injury, and that might have led to sepsis, that might have led to comatose or a death of the patient. They would have come for an injury, so you should be sensitive of the patient's perception and then go from there, right? And then, from talking to the patient or the attender, understand what are the information known to the patient and what are the information that is desired, because we are living in a Google era. Like it or not, patients are going to Google it, and there is chat GPT also now. Patients are going to type in it and come with answers. So we need to be equipped with information that the patient is known, and how we can clarify that and how to provide the desired information. So that comes, we need to have that knowledge. So I am a psychiatrist, so if you ask me to go and break the bad news of cancer to a patient, I am not the right person to do it, because I do not have the knowledge of cancer. I do not have the prognostic factors. I do not have what is the prognosis or how it is going to progress, etc. So that knowledge should be relevant, right? And obviously we have to address the emotions and be empathetic to the patient. So we can't be like, okay, you have cancer, and we can't just leave the place. We need to let them talk it out. We need to let their emotions out. And finally we have to offer some support and summarize what we have said. So in the process of addressing the emotions and everything, you should not forget that you have come to give the diagnosis of cancer. Summarize that, okay, this is the cancer, this is how we are going to go. So that is also important, right? So this is the spikes protocol that we use for breaking bad news. Another one important thing that we can learn in doctor patient relationship is transference and counter transference. A lot of you might have also heard of this. A couple of years ago they had asked a question on this. So there is a doctor, there is a patient. So this occurs commonly in psychiatry, psychology, but it can occur at any places. So when their doctor develops inappropriate feelings for the patient, and the patient develops inappropriate or projection of past emotions, the doctor to patient is called transference. Sorry, the doctor to patient is called counter transference. and the patient to doctor is called as transference. So in order to remember it simply, you can just think of like patient developing feelings towards doctors is called transference, and a doctor developing feelings towards patient is called counter transference. But in reality, that is not the case. So if you look at the history of patients, like you have like 10 patients and you see a particular name, let's say Mr. Raja or Mrs. Rani or something like that, and you get irritated. So that is also an inappropriate feeling. That is also counter transference. Or you feel, oh, thank God Raja has come today, I've been wanting to have a chat with him. That is also counter transference, right? So patient, patient again looking at you as a mother figure, as a father figure, as a brother figure, and developing all that sorts of feelings that they have, not just romantic feelings but also such feelings that can also be transference. So transference and counter transference is, as a term, you should know. Other things are not important for you. So in this chapter we have read about doctor patient relationship, what are the aspects of communication, and also Spike's protocol to break the bad news.